Hello, everyone. Thank you so much for joining. We will get started in just 1 minute as everyone joins the session today. But just a reminder that the session is being held in both English and in French. And please be sure to select either the English or French channel for interpretation available at the bottom of your screen. Hello, everyone. Welcome to today's event, Agenda Setting with Evidence and Context, using the Immunization Agenda 2030 Scorecard. I know people are still joining the session today, but we have a very full agenda, so we are going to get started. Before we kick off, I just wanted to give a few logistics and reminders. First, this session is being conducted bilingually in both English and in French. So if you are joining and looking for the French interpretation, please make sure that you follow the instructions on the screen to enable the interpretation and hear it in French. If you are listening in English, you can also choose the English channel in case there are any French remarks that need to be interpreted into English as well. And these reminders will be continued to be shared as everyone joins the session today. As a couple of housekeeping logistics, we do have the chat window feature available today. Please use it during the session to engage in dialogue with peers and the facilitators. You can also use this chat to ask questions throughout the session. We will have time for questions and answers with all of the speakers at the end of the session today. So please do test the chat now, share your name and where you're joining us from. And now I will turn it over to Dr. Chizoba Wanoti, the Immunization Director for the Momentum Country and Global Leadership Project. Dr. Wanoti.
Thank you so much, Jenna, for that kind introduction. I hope everyone can see and hear me. Good morning, good afternoon, and good evening, everyone. Thank you for joining the webinar today. And happy 2023. This year, 2023, is a crucial year for immunization programs because just next year in 2024, the world will celebrate the 50th anniversary of the expanded program for immunization. As such, we know we're going to count our progress when we get to those celebrations. So now is a crucial time to get back on track towards the immunization goals that we all have set for ourselves. And to do that requires concerted, coordinated, and aligned efforts. So today, we are here to talk about a tool that can help us track this progress, the Immunization Agenda 2030 Scorecard, or the IA 2030 Scorecard for short. This tool was released in October 2022, and it is an interactive tool that countries, regions, and global stakeholders, including country stakeholders and advocates, can use to visualize how each country and region contributes to meeting the immunization targets that we, all of us, as an immunization community have set for us under the IA 2030 Framework for Action. So the use of this scorecard can guide decision-making, program adaptations, and the like. So why does this matter now? Why is this urgent? Well, in about a month's time, on March 11th to be precise, this year, it will interest you to note that we'll be entering the 4th year since the WHO declared COVID-19 to be a pandemic. And during this time, immunization coverage has dipped to the lowest level we have ever seen in decades. Worldwide, 18.2 million children received no vaccines at all in 2021. It's unlikely that we are not fully aware of the dangerous ripple effects caused by the pandemic's catastrophic impact. Right now, we are starting to see outbreaks of diseases like polio, measles, and yellow fever, and it could be the tip of the iceberg. So measurement matters, tracking matters. In this webinar today, we want to present the IA 2030 scorecard, and we want to encourage integration of the scorecard into global, regional, country, and program agenda setting discussions. We want to encourage leaders from agencies and partners working at the global and regional level to be aware of the scorecard as a resource and to use it to have conversations with colleagues working in immunization program so that we can make progress, we can track and make progress. So the organizers of this webinar, the Boost community by Sabin, the USAID funded Momentum Country Global Leadership Project, started last June on this journey. They co-hosted a workshop with participants from over 24 countries to solicit feedback about the IA 2030 scorecards, usability, and use cases, because this is a tool that's been in development by global immunization partners. So the team received feedback on ways to improve the design and content of the scorecard, and specified methods of data collection and clarification of indicators. So today we're grateful for the opportunity to gather colleagues from the Boost community and our larger network of immunization practitioners, technical specialists, and policymakers to look at where we are now with the scorecard and discuss how we can really make it an important piece of the monitoring mechanism for the IA 2030 scorecard. How can we use it to keep ourselves accountable to the goals that we have set for ourselves to improve immunization in the world and ensure that no child is left behind? So we've gathered an illustrious panel today to talk about this. I'm so pleased to start off the discussion, or to have the discussion kick off by Dr. Folake Olayinka. She is, I'll introduce her in a minute. She will set the stage for the discussion today on how the scorecard can be used from a global, regional, and country perspective. And she is the right person to do this. Dr. Olayinka is a medical doctor with over 25 years of experience in clinical practice and public health. She has undertaken senior technical management and global leadership roles. She's well known in the immunization community, not necessarily because of her current role, but also because of her antecedents. However, she plays a very important role in the COVID enterprise right now. Currently at the USAID, she serves as the immunization technical lead, where she oversees a multidisciplinary team and a large portfolio of work, particularly on COVID vaccine rollouts in the world. Beyond her day job, Dr. Olayinka is also a member of the WHO Strategic Advisory Group of Experts, SAGE, She chairs the important Immunization Agenda 2030 working group on immunization programs for primary health care. And that is the strategic priority area #1. So I have no doubt that Dr. Olayinka will make this conversation what it needs to be, because she's been there from day one. Dr. Folake Olayinka, it's my pleasure to bring you on board to give us our opening remarks. Thank you.
Chizoba, thank you so much for those very warm words of welcome and the very kind introduction. This is really a dynamic session and webinar with a number of experienced and people on the panel and in the audience today. So thank you for inviting me to share a few reflections as we kick off the session. Let me start with USAID's long-standing commitment to immunization for more than 5 decades through various initiatives and programs, such as our work on preventing child and maternal deaths in 25 high priority countries that we partner with, USAID's contributions to Gavi, the Vaccine Alliance, in which we have been a partner since inception over 20 years ago, ensuring that no one is left behind. USAID is also playing a key role in the COVID-19 response, particularly in dose sharing, contributions to COVAX, for vaccines, as well as support to delivery. In addition to that, we have been supporting technical assistance in over 100 countries bilaterally to ensure global access and equity to COVID-19 vaccination. The pandemic has led to the declines in routine immunization and increased risk of vaccine preventable diseases, as Chizoba mentioned. And many of the Immunization Agenda 2030 targets are off track. And so this situation really calls for urgent action and coordinated action across all partners supporting countries. In alignment with global partners such as WHO, UNICEF, USAID is really working very closely to provide technical assistance to partner countries, addressing equitable access, quality of care, and improving the broader child survival and primary health care as we all align around intensified actions for routine immunization recovery in 2023. The Immunization Agenda 2030 was co-created very carefully with various stakeholders from multiple levels, and it harmonizes the collective global efforts of all partners to ensure no one is left behind, irrespective of where they live. The scorecard itself is very versatile and a highly useful tool tailored to regional and country context and needs. The indicators are adaptable to reflect national priorities and progress, and also an important tool for decision-making. So integrating the use of the Immunization Agenda 2030 scorecards into part of annual operational plans, national immunization strategy preparations, periodic, quarterly, annual monitoring and reviews are just some ways to use it. I use the IA 2030 scorecard, and in fact, in 2022, as the chair of the IA 2030 Strategic Priority Area 1 Working Group on Immunization Programs for Primary Healthcare, we looked at one of the indicators, which was the Universal Health Coverage Care Index, which is a composite of 14 tracer indicators, including the percentage of infants receiving Penta 3, the coverage of Pentavalent 3. And this really aligned with the launch of the framework for action on immunization for primary healthcare. And so the primary healthcare immunization for primary healthcare framework for action really highlights promising practices intended to showcase opportunities to leverage immunization to contribute to robust and strengthened primary healthcare. For example, you may want to check it out on the Immunization Agenda 2030 website. As I conclude these reflections and look forward to a stimulating panel discussion in just a moment, as a result of the COVID-19 pandemic, the number of unimmunized children has increased significantly, as Chizoba mentioned, from over 13 million to over 18 million. So 2023 is a critical time to intensify efforts on recovery of immunization, reaching zero dose, and those who have have not completed their immunization. So the time for collective action is now, and the scorecard is an extremely useful tool to monitor progress and inform our decisions for all of us at every level. So I want to encourage all of us to integrate the use of the IE 2030 scorecard into our immunization program activities. And I look forward to a dynamic exchange and panel discussion as we go forward. So thank you very much, and back to you, Chizoba.
Thanks, Falake, for that excellent framing of our discussion today. And without much ado, I would like to invite our next speaker, Paul Chenoweth from the CDC. He's going to give us an overview of the scorecard. And Paul is a core member of the IE 2030 Monitoring and Evaluation Working. Paul, over to you.
Great. Thank you very much, Dr. Wanondi. So good morning, afternoon, evening to all. So in the next several minutes, I will discuss the exciting role the IE 2030 scorecard is, the exciting role for tracking indicators of IE 2030. So could I have the next slide, please? To quickly set the context, I will walk you through these three sections of IE 2030, all accessible from the IE 2030 website: the strategy, the framework for action, and the scorecard. Next slide. So as many of you know, Immunization Agenda 2030, or IA 2030, sets an ambitious overarching strategy for vaccines and immunizations for the next decade. Next slide. There's a companion document to the strategy called the Framework for Action. The purpose of this document is to describe how 4 critical operational elements enable the successful translation of the strategy into its implementation phase. While the scorecard intersects all 4 of these elements, including number 4, communications and advocacy, I will present the scorecard largely from a monitoring and evaluation perspective. Next slide. So a detailed description of the IE 2030 M&E framework is presented in Annex 1 of the Framework for Action. And the M&E framework includes tailored indicators that enable use of data for action to continuously improve immunization program at all levels. Furthermore, it's intended to empower monitoring, evaluation, and action cycles for review of implementation progress and actions needed to achieve the goals and objectives. So it's really encouraging stakeholders to ask, how are we doing? How can we do it better? And who's responsible? So therefore, I think you can already see the huge need for a dedicated IA 2030 scorecard. Next slide. So within the Framework for Action, monitoring and evaluation framework, there are really 2 types of indicators, those related to the global impact goals and those related to the strategic priority objective indicators. So unfortunately, I will only have time to discuss the visualization of the 7 impact goal indicators. Next slide, please. So now the scorecard. So as Dr. Olalinki mentioned, it's an interactive tool which allows everyone to visualize progress against the IA 2030 indicators at global, regional, and country levels. For the immunization and PHC communities, it's intended to facilitate monitoring, evaluation, and action cycles. As mentioned previously, it's like, how are we doing? How can we do it better? And ideally, who's responsible? So it's new, it's innovative, and really has a great potential to strengthen the linkage between M&E and implementation. So that said, the work is not yet complete. There's much more work planned over the coming years. Next slide, please. I included this slide just to get you excited about using the scorecard and also to highlight there's much more of the scorecard than I will present. There are 4 main pages, and I will discuss really just the impact goal indicators. On the next slide, you will see a filter with a drop-down list of WHO regions, allowing you to display the indicator at all regional levels. So really just to zoom in to that region of choice. Next slide, please. So in addition to the graphics that I will show next, it's important to note that for each indicator page, there's a wealth of additional context, including the metadata, and which I believe this community requested. So thank you for that. Also the ability to download data, also the ability to provide feedback. So lots of additional content, which I will not display. Next slide. So next slide, please. So on to just the impact goal indicators. So the first one, save lives. So what does this graphic represent? This indicator is very involved, and here I believe the additional page content previously mentioned helps explain what is being measured and how progress will be measured. Though even with a standalone graphic, it's clear to see progress is not being made, and we are further away from the 2030 target than we were in 2019. As shown in the footnote, the WHO UNICEF immunization coverage estimates, it's the primary data source. Therefore, until countries make substantial progress to increasing coverage across all recommended vaccines, this will be a challenging target to reach. Next slide. So here we show 4 vaccine preventable diseases with endorsed elimination or eradication targets and the number of countries which have reached the target. So ideally, by 2030, all 194 WHO member states will have achieved the endorsed targets by for each VPD. So let me point something out that I find interesting about measles. So in 2020 and 2021, 9 countries are shown as reestablished, the salmon-colored sliver, meaning that the country had been verified as having achieved measles elimination, but unfortunately, were not able to sustain this success. Though please note, several of these countries lost their elimination status prior to the pandemic. Next slide, please. Thank you. So slightly related to Impact Goal 1.2 is the indicator on large or disruptive outbreaks. It shows the indicator across all countries. And here we see that 3 VPDs had more larger disruptive outbreaks in 2021 compared to the baseline. 2 had fewer and 2 had no change. So here's the trend. That's what it's going to be important to monitor going forward. So we can expect yearly fluctuations, but the target for 2030 is a decreased trend in the number across all years. Next slide, please. Number of zero-dose children. So as I already highlighted earlier in the presentation, I think this is an indicator we're most aware of, and perhaps it's one that is most easy to communicate and also to visualize. So unfortunately, as you know, given the disruptions brought on by the pandemic, the number of zero-dose children increased from 13.3 million to 18.2 million in 2021. So needless to say, we are much further away from reaching the 2030 target of approximately 6.6 million given this setback. Next slide, please. Here's one indicator that we say is on track. So to achieve the global target of at least 500 cumulative vaccine introductions in low and middle income countries, we would need to average 50 introductions per year. In 2020, only 28 introductions were made, though in 2021, we far exceeded the annual number, the annual target of 50 introductions with 167. Though please note 127 of these introductions were the COVID-19 vaccine. So such details can actually be seen online that are not necessarily displayed here. Next slide, please. Delivery across the life course. So we previously discussed life saved and the zero dose children indicator are off track because of declining immunization coverage. This indicator shows that the vaccines across the lifespan saw clear drops in coverage, namely DTP3 and HPV. And furthermore, really great strides will be needed to reach the coverage of 90% for each vaccine by 2030. Next slide. Also highlighted earlier in the presentation is the universal health coverage. So this is the final impact goal indicator, and I won't spend much time on it given that we only have baseline data at the present time. However, just to say that this indicator, will not be reported every year. The cadence is every other year, but it's my understanding that the pandemic did slow down the reporting of the UHC index. Next slide, please. So just like the impact goal indicators, 11 of the 15 strategic priority objective indicators are also visualized on the scorecard. Unfortunately, we do not have time to review, but would encourage you to explore on your own. Lastly, the summary. So we covered a lot of information rather quickly. I hope you found it useful and sets the stage for a rich discussion. I will close by saying the scorecard is already a success in terms of illustrating progress of I-2030 indicators and clearly visualizing the devastating effects the pandemic had on immunization. Lastly, despite these successes, we recognize the scorecard has not yet reached its full potential to facilitate the monitoring, evaluation, and action cycles. Thus, you will be seeing some substantial updates in the scorecard in the coming months and years ahead. So thank you very much for your attention, and back to you, Dr. Winondi. Thank you.
Thanks so much, Paul. I really like how you walked us through the scorecard, and I think the audience appreciate that as well from all the requests. So we're just going to go next into a video.
Hello, I am UNICEF Goodwill Ambassador Angelique Kijo. I am a mother and an advocate for children. Vaccines protect us and our children's future. I am excited to tell you about a new scorecard that reveals how well the world is doing at ensuring access to vaccines worldwide. The Immunization Agenda 2030 Scorecard is a publicly available interactive tool that shows key data to guide immunization leaders and advocates to understand who is being reached and who is being missed. The scorecard is part of the Immunization Agenda 2030 strategy endorsed by all countries and the World Health Organization to create a world where everyone, everywhere, at every age, fully benefits from vaccines to improve health and well-being. The scorecard is a tool for accountability. It shows we are now off track with much pandemic-related backsliding. Last year, more than 18 million children didn't get a single vaccine. Coverage of vital vaccines like HPV dropped substantially. The scorecard can guide our efforts to fight for a better future for our children. Join me in exploring the scorecard today. Go to scorecard.immunizationagenda2030.org. Thank you for your work for the good of people everywhere.
Thank you. You've heard it from our speaker. Go explore the scorecard and see what it can do for you in your program. All right, so we move on next to our panel discussion. It's my pleasure to welcome our esteemed discussants. Dr. Niklas Danielson is a senior immunization specialist at UNICEF. Dr. Onyovo Efe Aluta, technical officer, immunization and program management, inter-country support team West Africa at the World Health Organization. And Ms. Loris Lote, she's the co-chair of the IA 2030 Communication and Advocacy Working Group. She's a senior director at the Global Health United Nations Foundation. Welcome, panelists. I'm really excited to have you here today. So I'm going to start with you, Dr. Niklas. Can you tell us, how does the scorecard help audiences understand the impact of the pandemic on immunization systems? And why should we make data visualization? Why should we make a website about it? Dr. Niklas?
Thank you very much, Itzawa, for the invitation, and hello to you all. To vaccinate all the children in the world is no small task. It's a long distance race rather than a sprint. Maybe best described as a cross-country relay. It requires time, teamwork, and perseverance. The national immunization programs and the many local and international partners who support them did well in the last decade leading up to IA 2030, but we didn't really improve our position in this race. We have now set a new ambitious goal for the next part of the relay, the IA 2030 decade, namely to halve the number of unvaccinated zero-dose children. But just as the IA
You're muted, Dr. Niklas. Dr. Niklas, you've gone on mute. Can you unmute yourself?
I got a message that the moderator muted me, so it wasn't me. I will continue from here. Yeah. But just as the IA 2030 leg was about to start, we were hit with this COVID-19 pandemic, and we, in a way, dropped the relay baton. As a result of the pandemic, the annual number of zero-dose children increased by 5 million to 18 million unvaccinated children in 2021, and that is just in 1 year. And in total 25 million children started vaccinations, but did not complete them in 2021. In a couple of months, as the reports start coming in from countries, we will know the number of unvaccinated zero children in 2022, and the data will be at your fingertips here on the IA 2030 scorecard. Now, the 18 million unvaccinated children belong to the most disadvantaged and marginalized communities around the world. And the focus we now have on finding and reaching the zero-dose children in every country is, of course, an opportunity to make sure that the same children get access not only to vaccines, but to water and sanitation and a birth certificate, and later are enrolled in school when that age comes on. Zero dose is a marker of the children and the families who have been left behind for a long time. And in tracking the unvaccinated is about much more than just getting them vaccinated. It is a chance to extend social protection to those who need it most. But take note also, the scorecard is not a competition. It's about doing better from year to year. The challenge is how each national program can reach more children every year and increase the number of children who become what we call fully immunized children. The scorecard will make our efforts visible And I have tried it out. And you heard it from me, maybe first, that the interface and the visualization of the data in the scorecard are great, man. So make use of it, make use of the scorecard, spread the link of the website to the health workers and managers and decision makers in your country, because data speaks, but only when it is accessible and understandable. And the data in the scorecard is. So again, please go out there and use it. You have it at your fingertips. Thank you.
Thank you so much, Dr. Nicholas. I really like your closing remark that data speaks, but only when it's accessible and understandable. And hopefully the scorecard does that for us. All right, so my next question goes to Laurie Sloat. Laurie, what are the advocacy priorities for IA 2030 this year as the chair of the working group? Can you bring us up to speed on that?
Sure, thanks, Dr. Chizoba. I'd also just like to say that I am the co-chair of the Advocacy and Communications Working Group, and my co-chair Pragya, who's from UNICEF, is joining me on this call today. And just a big thanks, because we work collectively with all of the partners associated with IA 2030. And so in our discussions as a group and as a team, we came together last year and in discussion with some of the governance mechanisms within IA 2030, such as the coordination group and the partnership council, which represents sort of the political advocacy side of some of the heads of the agencies, the Deputy Secretary General of IFRC, for example, WHO, UNICEF, and so partners in that. So in our discussion, as some of you have already alluded to, we recognize from the data that came out last year, from the WUNIC data, as we all call it, the WHO and UNICEF data that comes out in July, that we really are going in the wrong direction. We're backsliding related to the COVID pandemic. And so this year, 2023, we're working together to highlight the catch up and recovery that is needed. And so it's a year of renewal towards the IA 2030 goals that we have set out. So specifically, what we're looking to do is to increase the recognition of the number of zero-dose kids and also those under immunized. So that's number one. The second one is to unlock resources in countries to do the catch-up and recovery processes that are needed. I'll come back to that in a second. And then the third issue is to generate high-level political will in countries. Hopefully this can be at the head of state level. It requires ministers of finance and ministers of health, as we all know. So those are the three main objectives or outcomes we would like to see happen. Now, I'm going to come back to each one of those really quickly, just to sort of give a little bit of nuance to that. Around the zero dose agenda, as many, Paul, I think, alluded to it, and also Nicholas as well, and Dr. Fulaki, we are going in the wrong direction for the zero dose kids. So what's new is the increase of the number of zero dose children. The zero dose children agenda has been ongoing for decades. You know, starting in 2019, we knew that the number was 13 million kids worldwide. And so there was a 50%, that's the goal. And you can see it very clearly in the scorecard as it was generated, that we're going now as an increase, as some have alluded to 18 million. So that's an increase in 5 million. We want to highlight this. There's an additional 5 million children out there since the pandemic that have not received any vaccine at all. So that's one. The second thing is around sort of the unlocking the resources. COVID did bring some opportunities in terms of financing into countries. And so how do you leverage some of the unused resources as well in countries to generate around immunization strengthening? So we hope to achieve that through putting a spotlight on this issue of the year of renewal and the catch up and recovery. And so how are we going to do this? So we're working together to develop a global campaign that will highlight this throughout the year, and so that we are in a better position next year as EP we celebrate, as Dr. Fulaki said, the 50th anniversary of the expanded program of immunization. So what we hope to do is have a global campaign. We will need all of your support, and then also have a little bit of intensification efforts in the 20 countries where there's the highest burden of coverage and zero-dose children. So I'll stop there, but we're happy to answer questions, but that's kind of our overall agenda for this year. And just to say that we will, of course, be working with global partners as well as in-country consultations that are already happening in terms of how we can highlight these issues and what it's going to take to ramp up efforts in country by countries to get us back on track. So thank you.
Thanks, Laurie. I think that's really clear. You want to increase the recognition of the problem, unlock resources, mobilize political will, and then launch a global campaign. So I'm going to move on to Dr. Onyovo right now to ask him how the political context in each country plays into the review of immunization progress. The scorecard, for example, has a page for each country, and you can compare one country to another. So how can this be used to spur constructive competition at the country level, given that we have this advocacy plan ahead of us?
Thank you very much, Dr. Chizoba, for the opportunity, and thanks to the team for the opportunity to be here. But most importantly, I'd like to thank everyone for the time you've taken to participate. We're talking about the IA 2030, and the truth of it is that everyone has a role to play. Paul, in his presentation, touched on some of the visuals and indicators on the scorecard, and some of the other members of this panel have also touched on the immunization gaps and the need for these scorecards. So just to, again, ask that you take your time to go through the scorecard. The link is shared in the chat, and it's a very powerful tool that we can use for decision making. So back to your question, Chizoba. The first is that it's a scorecard, and one of the things that it shows is the country and regional progress. So it presents all the information and progress achieved on the IA 2030 indicators in a very concise and illustrative way. And this is very important, particularly for policymakers. So for example, in using the scorecard, I can easily access the number of future deaths to be averted through immunization in the African region. I can compare regions to regions. At country level, we talked about zero dose. Laurie mentioned that we could actually easily review the number of zero dose children between countries, regardless of their regions. Now, in line with your question, this is actually very key for policymakers, technical advisors, implementing partners and teams. And why is this so? It's because countries can share this information. They can use it for peer reviews. Because of the way the scorecard presents the information, you don't need to develop charts. It presents the information you need in a very readily accessible format that policymakers can easily interpret and use for decision making. At the regional level, when we have engagement meetings with ministers of health or with EPI managers, this is actually a very powerful tool that helps to facilitate peer reviews. So for example, Cote d'Ivoire can look at the data and compare some of their data with what Congo-Brazzaville is doing, and they can also look at some of the indicators and have that peer review mechanism where they can, among themselves, review their performance and have a pathway towards improving that. In terms of the comparisons as well, and apart from policymakers, it also provides tools for other high-level engagements. So I talked about ministers of health, that when we have engagement meetings with them, it presents that information where when you want to track the source of the data, I see some of the questions being asked about the source. It pulls together data from different verified sources, such as the WENIC and other available data in a readily accessible format. And this actually helps in advocacy efforts and makes advocacy to be very simple and easy to do by policymakers. Thank you.
Thanks so much, Dr. Nuvo. The scorecard provides concise and comparable information that countries can use to compare each other. So I know you working at the regional level, that would be an important tool for you in working with the country EPI programs. So I'm gonna then turn to all the panelists now and to ask, any one of you can jump in. The scorecard can be used for advocacy, for briefing decision-making, as we've heard from Dr. Nuvo. It can also rapidly surface program gaps. It can let us know where resource allocation is needed. It can support advocacy policies. Now, those are all nice and good, and those are things that the scorecard can bring to the table. But what about some of the limitations of the scorecard? Are there some that come to mind that we can discuss today so that we know how to put those in perspective? So I'm leaving it open to the panelists. Anyone wants to attempt the question? What are the limitations of the scorecard?
So maybe I can go first. As I mentioned, the scorecard helps to benchmark progress being achieved and provides a means by which countries and policymakers can review the targets that have been set on the IA 2030 and how much is being done on that. This is fantastic. But we have to also realize that it's an online tool. And because it's an online tool, one of the limitations in it is it needs to be accessed. So teams would have to be directed to the scorecard to actually use the scorecard. Otherwise, it's just the scorecard. So one of the importance of this meeting is to see how everyone can be aware of the scorecard and actually promote it, at whatever forums that they are. So in line with your question, Chizoba, if we don't promote the use of the scorecard, then the ability to use it for decision-making becomes stifled.
Okay, so you have to know it exists before you can use it.
Absolutely.
Okay.
And
Laurie, any thoughts?
Yeah, I think I would add to that. I think there's some, while there's limitations, it's a challenge, but also an opportunity is the way that I would put that, is that it might not be readily identifiable how to use this towards policy recommendations. So maybe if I could give an example, right? So the data appears to be quite static, right? So it's a little bit older data. We'd like to see it, eventually become a little bit more real time, but these are processes that take a while to collect that data in country. But one of the things where I would say it's a limitation and then an opportunity is that if you take an example where we've been talking about the zero-dose children, right? So we know that we're off track. There's an additional 5 million, okay? So we're at 18 million zero-dose children globally, and we need to get to about 6.6 by 2030. So if you do the math over the next 9 years, we would need to reach an additional 1.3 million children, right? That we don't normally reach, okay? In order to get there. Now, how do you translate that into country action? So I was just quickly looking at who has joined us, and I really do appreciate everybody's time in this. And there's people, I've written it down, from Nigeria, Cameroon, Malawi, Brazil, Niger, the list goes on, Ghana, Lebanon. So I took a look very quickly, because you can, at the scorecard of what are the number of zero-dose children in those countries. So in Nigeria, it's 2.25 million. In Brazil, it's 710,000, right? So when we need to get to a reduction of 1.3 million kids per year, then what can the countries do to use that information and look at their own national policies and their numbers and say, how do we get to 710,000 in Brazil? What's a realistic target to improve? It's pretty tough to say in decades-old problems that we're going to get to all 710,000 in Brazil because it's been going on. But maybe it's a way to sort of set a target so you can see how we're working towards global progress. So that's an example. But where I say it's a limitation is that's not exactly, you have to do a little bit of data analysis to sort of get there, right? But how do we use these numbers? So how do we actually take what appears to be static indicators to actually generate it towards policy, target setting, and actions of what needs to be done? So that would be sort of my kind of take on the scorecard to date. And we hope to see it improve over time, where policy recommendations could be included of what has been adopted to get us there. For example, that could be an added feature of the tool in the future. And or how do we get to a little bit more real-time data over time, recognizing it's quite difficult to do that. Thank you.
Thanks for that. So, one thing I took away from that is that right now the countries don't have targets. We have global targets, but not country targets. And that's because those targets need to be generated and by the countries themselves, not set by the global stakeholders. Okay, thanks so much for that. Nicholas, do you have any thoughts on the question? What are the limitations and opportunities to improve the limitations?
Well, I see more opportunities than limitation, I have to say. All data has limitations. The important is that you understand the limitations and don't overinterpret or oversimplify what you are looking at and drawing the wrong conclusions. And I think the limitations are the very typical ones. Many countries have great uncertainties around the denominator, how many children are born where in the country. And that creates uncertainties, and you will see that also in the scorecard, that there are differences between the administrative reporting, the coverage that is calculated from that, and the coverage that is reported from the analysis for the VUNIC data. That it doesn't go very deep at subnational level. There are a number of countries that report administrative data to WHO and UNICEF in their joint reporting forms, and that data will be displayed. The VUNIC estimates this looking at the data from different sources and estimating how valid the administrative data is, doesn't look at subnational data because we don't have the parameters to do that. But overall, I think the timeliness of the data and the accessibility of the data in the scorecard is unprecedented. We haven't had this before. The VUNIC data has come out in publications about a year after they were actually received by WHO. Now we will see something that is much easier to use for program management and for advocacy. Thank you.
Thanks so much for that insight. I was really struck by your emphasis on all data have limitations, and particularly with immunization data, we know denominators, data quality is a problem, and we should not oversimplify, neither should we overinterpret. Thanks for that. Okay, so I want to turn to the audience right now. I know that there are some questions that have been popping in the chat, and my colleague Rose has been curating those questions for me. So, so I'm going to pose the questions to you, my esteemed panelists. So the first question goes to Laurie. It says, the data on zero dose disaggregated by country and regions in the country. How can this be used by countries and regions to stimulate action? Laurie, I think you've answered this for the large, for the most part. If there's any other thing you want to add to what you've said before, feel free to do so.
No, I think, that's a trick. I would say, taking a look at, and it takes time, right? But like actually looking at each of the indicators and what resonates with the country of the action that wants to be taken in and by the country. And so the example I gave was with zero dose, saying, okay, if we need to reach this global target, what does that mean in my country? And how can I work with the ministry and partners to achieve a certain target, maybe set a target in country? And so the tool can be used for that, where I gave the example of Brazil, there's 710,000. But, equally, I would love to see, we don't really talk a lot about what about Europe and the States? And I looked up in the US, I didn't know this, I'm from the US, and there's 110,000 zero dose overdose children. So how do you get to those pockets of kids, and how can you say that that contributes to it? So I think it's a very powerful tool in that way, but it needs to lead to in-country discussion of how those targets can affect policy change.
Okay, thank you so much. I want to pick a question from John Barrazu. He says, and this question is to Paul. He says, do averted deaths calculation for VPD over time assume that all other factors are unchanged, such as improvement in nutrition status or treatment of disease? So John, I'm sorry, Paul.
Yes, thanks very much for the question, John. So as far as improvements to nutritional status or treatment of disease, it doesn't look at those specifically. However, one of the factors that goes into the calculation of this indicator, besides the coverage estimates, is the population. So the population divided by the United Population Division, or the United Nations Population Division, which could very well take into consideration those factors while estimating the population on a yearly basis. So this indicator is somewhat interesting because not only does immunization coverage change every year, so does population. So we saw a decrease in the overall population based on the COVID pandemic. So I think we'll be seeing kind of changes to how this indicator is reported going forward. But to answer your question, it does not include, the inputs are dynamic, but not specifically related to immunization or the treatment of disease. Thank you.
Okay, so Paul, don't relax yet. There's another question for you. So it says, this is from Chitan Sharma. Says, how is a vaccine introduction defined by the MIE framework and the scorecard? Says, previously it was my understanding that WHO defined introduction as inclusion of a vaccine into the routine schedule. Campaigns or short duration activities were not included as introduction. So for example, outbreaks of campaign did not count, e.g. rubella campaign, yellow fever campaign. So, and this does not align with COVID-19 introduction. So I guess it has to do with the visualization around introduction. So how is the scorecard calculating that or operationalizing that indicator?
Yeah, great. Another great question. So given that we have very little time, we'll be very brief. There is a definition of an introduction on the, within the framework for action that was referenced earlier, as well as on the scorecard page for the, for this particular indicator. So introduction is the addition of a vaccine into the national immunization schedule, and that vaccine needs to be used for a sustained period of time, greater than 12 months. However, to get to your question, why COVID is not part of the routine vaccination schedule. However, at the time of the creation of this indicator, it was decided to use COVID-19 vaccine or include COVID-19 vaccine in the list of antigens based on an interim recommendation. So the fine point is the interim recommendation. Thank you.
Thanks so much. Nicholas, I'm going to give you the last word. The last question is, we've talked about backsliding, but do we know the reasons behind the backsliding? That's a question from Maja Romanska.
Well, we know some of the reasons are, and there are multiple. There are many things working together. At the start of the pandemic, we had a lot of measures like closing down movement in countries, closing down schools, making it more difficult to visit health facilities. There was also at times a fear among parents to visit health facilities, but because it was felt that that was one of the points where you could be exposed to COVID-19. Other things that has become clear over time is, of course, diversion of resources and attention. Some of the necessary to to counteract, to fight the pandemic. Yeah. Sometimes I would say also a little bit of lack of understanding or imagination of what some of these measures could actually mean to the provision of other services, not only vaccination services, but also antenatal care and delivery service and other primary healthcare services. And I think this is going to be an important lesson for how we respond to outbreaks in the future. It is also the fact, I think, that many of the countries that have been hardest hit, where we have seen the largest increases in zero-dose children, are countries that have comparatively weaker health systems, and the resilience is not really there. It's quite understandable, but this is also an important lesson for the future, that we need to build stronger, more resilient health systems that can cope with impacts from pandemics or other unplanned but foreseeable impacts that can happen to health systems. So it's a wide variety of things that happen, but all worked unfortunately in the same direction of making it more difficult to provide the immunization services and more difficult for parents to access them. Over.
Thank you so much. I think we've come to the end of the webinar. It's been a very interesting discussion. I would like to thank all the panelists for their really insightful comments and contributions. And to the participants, I just want you to take this away, that the scorecard is here to help us make sense of progress or lack of progress in immunization. It's on the website. It simplifies the data. It brings the data at your fingertips. Please go explore it, use it for advocacy, and give us feedback on how your experience has been with using the scorecard. I want to thank the team led by my colleague Rose Weeks and Jenna, Angela, all the people who have helped bring this event together today. Thank you so much and have a wonderful week.
Thank you so much.
Thank you, Dr.
for
Wanodi.
listening.
Thank you, everyone, for joining.
Thank you, everyone. Such a pleasure.
Thanks everyone for joining.
Merci beaucoup. Thank you very much.
And please
Thank
do
you, everyone.
fill out the post-session survey. Thank you.
Merci beaucoup.
Thank you. Bye-bye.